Let's note some easy features to see on the cat. I can see spinotrapezius here. I can see latissimus dorsi down here. Spinotrapezius is pretty easy to see along here. Latissimus dorsi. It's relatively easy to see triceps, even though this is not dissected out. This is where the triceps muscle is located. And on the rear hind quarter is the biceps femoris or bicep femoris right here. It's going to flex the rear leg. By the way, the triceps extends the front leg. When we look on the inside of the thigh, the gracilis is this muscle right here, and it is an adductor of the thigh. It's pretty easy to see a femoral vein right here in this cat. I have a male and a female specimen, so I'm trying to give a good broad look at everything. So if we look at this female, it's easy to see her anus here, and the opening to her vagina is here. In the little male cat, easy to see testicle or testis here. So that is identification of male and female. If we look in the neck, it's easy to see the trachea here at the end of my finger. When we look at the internal anatomy, I can see cranial, middle, caudal, right lung. I can see a mediastinal lobe here. I can see a cranial, middle, and a caudal lobe on the left lung here. I can see liver. I can see gallbladder here. Stomach. Very, very majestic omentum drapery that goes over the front part of the intestines. If we look on the inside of the intestines, we can see the mesentery. This is what suspends the intestines on the back of the abdominal wall. It's kind of clear, kind of like cellophane or something. Interesting. I am identifying the thicker feature here as rectum or large intestine, and then the smaller portions as small intestine. This is the cecum. The cecum is located here, and the ileocecal valve is located inside of here. I'm going to say this is ileum ileocecal. It's easy to see that the larger intestine is thinner and less muscular than the small intestine. It's pretty easy to see that. If we look at the kidney, if we look at this kidney has a coronal cut. It's kind of easy to see the cortex and the medulla inside. These are usually located retroperitoneal. Let's go back to the female cat for just a minute, because here we can see a uterine horn. We can see a uterine horn on the right side, and if we look very closely, there is a little ovary right here. Interesting. Cats have a bifurcated uterus. This is the bladder located here. If we go back into the abdominal cavity, this is a very easy view to see that the kidneys are retroperitoneal. Lots of fat around the kidney here on the right. Also, if we look a little bit higher, we can see this licky tongue looking thing right here, the spleen. We can see the stomach. We saw that a minute ago. Let's try to see if we can identify any of the arteries that may be easy to see. Let's go back up. Not viewing too much right there. The blue down in the bottom of the viewfinder right here, that is the superior vena cava. It looks like I can see an external carotid here in the neck. That's pretty easy to see, that little pink tube right there. We're just trying to pick out things that are really super easy to identify right now. I think I have just about covered it. We thought this was rather interesting. If you look at the paw of this kitty cat right here, and then look at the paw on this one, this is rather interesting. I'm seeing, instead of 1, 2, 3, 4, I don't know how to count these, 5, I'm seeing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I'm not sure what I'm seeing here, but this is rather impressive. And this may just be an adult cat. You may be laughing hilariously at me because this may be just really normal or something. Maybe it's 1, 2, 3, 4, 5, 6, 7. I don't know how to count this up. Let's look on the back. See, that looks like a normal paw print of an animal. That does. So does that. And okay, we got some gray paws. I didn't know we had light colored and dark colored ones. Here's the gray in the front, but now look at this other paw print here. Is that not interesting? Weird. All right, we'll try to put this out and see if this flies. Okay, I cannot pass up looking at this. I'm looking at a kidney, and look how this lobe of the liver has exactly formed around the margin of the kidney. Is that not interesting? Interesting cat anatomy. Want to see a shiny cat gallbladder? That is almost iridescent. Check that out. Interesting.